Now today, about 800 million people around the world suffer from undernutrition, and it is a condition that leads to some 9 million deaths every year. Doctors, though, in DR Congo are trialling a new approach to dealing with child malnutrition, and the results show that they are rather effective. To discuss, our health editor Julia Seeger is with me. And Julia, first of all, just tell us, what exactly is malnutrition?
That's right, Nadia. I think it's important to go back on this term that's often confused with hunger and undernourishment, but actually malnutrition refers to the deficiencies, but also the excesses and the imbalances in a person's intake of energy and or nutrients. So it's a nutritional state, if you will, which is the consequence of an imbalanced diet, let it be in quantity and or quantity. So it means it encompasses both undernourishment, which then leads, as we know, to weight loss and stunting. But it also encompasses obesity, which then leads to all the pathologies that we know of, heart disease, but also diabetes and certain types of cancer. Now, in both cases, malnourishment is going to weaken the immune system of people and can then lead to death. And because it encompasses both undernourishment and obesity, it's now considered to be the #1 cause of illness and death in the world because it concerns both the northern and the southern hemisphere.
Now, you're focusing today particularly on undernourishment, and that's because the figures there are really quite alarming.
That's right. NGOs had made a lot of progress on the ground in recent years, but because of COVID-19, those numbers of the number of undernourished kids is actually going back up. There's about 800 million people who suffer from undernourishment in the world today. 24 countries are considered to be particularly at risk, and as you can see, it's most prevalent, of course, in the southern hemisphere, and women and children are the most affected by the scourge. Now, there are many factors at play here that trigger malnutrition. There's, of course, climate change, lack of access to drinking water, but also poverty linked to economic crisis. There's also conflict, of course, and here, what's happening in Yemen is actually quite dreadful. There's all of these cases of severe acute malnutrition. Now, when talking about undernutrition, there's two different situations that need to be differentiated. For one, you have what we call acute malnutrition, which is directly linked to a major deprivation of quality food, but also linked to diarrhea and malaria. And on the other hand, you have chronic malnutrition, which is something much more in the long term and often linked to a situation of lasting poverty. Now, here we're going to focus on acute malnutrition. And what's very important here is actually to have an early diagnosis and being able to bring that treatment to children and women specifically because they're more affected on time. And there's this dreadful statistic by the UN's Office of the Coordination of Humanitarian Affairs, OCHA, which said that in 2019, only 30% of kids who were undernourished actually got access to a treatment on time. And it's because of the statistic that the NGO Alima decided to develop and test a new protocol in a clinical trial in the DRC. And the results, as you said in your introductions, are very promising. Well, to talk more about it, let's turn to our guest, Dr. Susan Shepard. She's a pediatrician at Alima, and she's the lead scientist of the study. Hello, and thanks for joining us.
Hello, pleasure to be with you.
So this new protocol that I just spoke about is called Optima. How is it different from the standard protocol that has been put in place many years ago? And how is it changing the way we're dealing with undernourishment? Or how could it change the way we're dealing with undernourishment?
Well, the overall goal is to get treatment to more children as early as possible in the course of malnutrition. And so I would say that Optima differs from the current standard protocols on 3 main points, and all geared around simplification. And so the first main point is that we use this the middle upper arm circumference. I don't know if you can see the bracelet with the tape measure on it here, to train families to diagnose malnutrition in their child. Families are, of course, the people who are best positioned to detect early, and we recommend that families measure their child once or twice a month, and more often if they develop a fever or other type of illness. And all of this is geared towards early detection. The second major simplification point is, malnutrition is a single condition, but it's kind of arbitrarily divided into moderate or severe malnutrition. The coverage figures that you provided of 30% children receiving treatment, that's for severe malnutrition. For moderate wasting or malnutrition, it's even less. It's substantially under 20%. So combining two programs into one simplifies things for healthcare workers and program administrators. It takes two different supply chains and puts it into one. And the third point is making, by early detection and getting children into treatment early, we simplify care. It is far more easy for families to manage care in an outpatient setting where they're providing treatment to their child at home than it is to bring them into a hospital. And so by treating children earlier, we hope to reduce the number of people the children who are hospitalized.
Now,
thank you.
Dr. Shepard, we often talk about food waste in developed countries, and some believe that the problem of undernutrition should not be one in 2022. Why is it so difficult to eradicate this longstanding problem? And is there indeed a lack of commitment, perhaps, from the international community, a lack of political commitment there, or is it just that the situation is much more complex?
Well, yeah, I think this is an exceedingly complex problem. It involves not only access to adequate quantities and quality of food, but I think you cited, clean water, timely access to medical care, families having sufficient money to meet their basic needs, which is why poverty and acute malnutrition or malnutrition of all forms are so tightly correlated. But it's not insurmountable, and it does take commitment. It takes political will, and it takes political will on the parts of governments where malnutrition is a particular problem. So as it is an exceedingly complex problem, it's also exceedingly heterogeneous. And so what works in Thailand may very well not work in Congo. But the goal of the program such as Optima is to make it easy and efficient for families, for health workers, and for governments to put in place policies that will get to kill children earlier and reduce the burden of malnutrition in their populations.
Well, Dr. Shepard, thank you very much indeed for telling us more about the Optima program by Alima. So now I invite all of our viewers to go on the website of Alima, because there are so many other research projects that are currently underway. This Optima project is going to be, there's a clinical trial also happening now in Nigeria to be able to see if we can transpose this situation to indeed other countries.
Julia Seeger, our health editor, thank you very much.